She pretty much has had a lifelong history of not wanting to use that leg. So we have to teach her that, okay, you had this surgery for a reason, and it's now possible to use that leg. Do you usually use a harness with her, or a collar, or a harness?
A harness.
Okay, that's good. Harness tends to shift the weight further back. You know, when they pull against the harness, it shifts the weight further back, and that's helpful in getting her to weight the rear. As tiny as she is, I would do, I teach a lot of these exercises for cats. I would do a little exercise like this, dangling exercise. And see, she's very fearful of using it. Come on, baby. Oh, good girl. Good girl. See that? There's a neurological response when you stroke the base of the tail that helps to enhance. It helps to enhance rear limb movement. And what it did for her, she's curling her tail because she's fearful. She doesn't want to put the leg down. She also doesn't know who I am. So what I did is I just took and I just stroked her tail. It's going to work this time. Last time it actually got her to put her foot down. Come on, sweetie. Come on. Come on. You're really good on that left rear. Yeah. So I'm not forcing right now. All I'm doing is kind of letting the weight of my hand hang on her leg so that she realizes that I'm not trying to crank on her. I'm not trying to be forceful about it. I'm just trying to encourage her to put her foot down. All right, so we're going to go back and start from basics. First things first, you can do ice packs on this hip to help to calm any pain she might be having, to help to flush any inflammation that there is remaining from post-surgery trauma. It's only going to take, she's a very small dog, it's only going to take like 3 minutes. And you might want to put a thin like washcloth or a paper towel between her and the ice pack because she's shaved really well and she's going to be real susceptible to that cold. So, but see if you can convince her to allow you to just put an ice pack on here and even hold it. You're fine. So you could just do it right here. You know, just sit and watch TV and hold an ice pack right there. You could do that 3, 4, 5 times a day for just a few minutes each time. You want the tissue to actually, you want her skin to actually get pinkish. You don't want it to turn blue because that's too cold, but you want it to get pinkish, and you want her, she'll probably be a little squirmy because she's a small dog and that's going to pull a lot of heat out of her. But the great thing about that is it helps to create a big influx of blood into the area as soon as you pull the ice pack away, and actually it starts before you pull the ice pack away, and that helps to stimulate healing. It helps to get rid of inflammation, and it's really good for overall general tissue health. Yeah, very easy. Might be good, although I have wet swimming trunks on, so I don't know how well she'll accept that. And then all you want to do, okay, is get a hold of the foot, and what? Her first complaint. Oh, good girl. Good girl. So she's very wary of going into hip extension where she stretches out the hip behind her. And that was probably all along the most painful position for her. So she's wary of it, even though there is no hip socket anymore. And it should not, there shouldn't be any reason that she would have any pain. She's expecting pain. So this is, a lot of this is anticipation of what used to happen. And since she hasn't experienced the fact that it shouldn't be painful, or it isn't painful now, she's still very cautious of it. So all I'm doing is I'm just cradling her paw between my thumb and the palm of my hand and keeping her toes extended. They're straightened out. If you curl the toes, she's going to tend to want to curl the leg. If you straighten the toes, it should inhibit that curling effect, that flexion effect, and you should be able to straighten it as much as she will allow you before she gets fearful. Oh, everything's fine as long as I don't play with the leg. Let's try some. Let's try some. Let's try this leg. What? It's the other leg. Oh, okay, that's okay. All right. You just don't want me to control anything. You're tough. What? What? Look, I'm blowing in the wind. It's like she's a model, a supermodel at a shoot. The hair's blowing in the wind.